Jeremy Daly is a physician assistant at Tripp Family Medicine here in Twin Falls. He has nothing to do with building the bridge on the River Kwai. The music is just at random. But we should point out he's here today to talk to us, and we do this every Wednesday. We talk about medical issues, and he's also available to take some of your telephone calls too. We're at 8:34, and it's 14 right now on News Radio 1310, KLIX, and NewsRadio1310.com. I wanted to point out too that Dr. Tripp's office is located on Fillmore Street in Twin Falls, on the north side of the city. And if you're at the post office on Fillmore Street, you see it looking directly out the front door across the street. But first of all, welcome back.
It's good to be here. Thank you, Bill.
You've gotten a little furrier since we last talked.
Just trying to keep myself warm with the dip in the temperatures, Have to do something.
I shaved and you grew a beard. What are we talking about today?
Well, one of the things that I wanted to talk about today was some of the recommendations. It's from the USPSTF, so it's this Preventative Service Task Force that the U.S. has put together, and some of the recommendations that are given to us as clinicians to screen our patients, and tools that we're given to help basically catch disease early on and catch problems early on so that we can take care of our patients to the best of our ability. So, there's a lot of people that come into the office and say, I have a family history of this and I'm concerned about that. And I know there's a lot of people out there, our listeners probably, who wonder, well, how can I know if this is an issue? How can I kind of put myself in a position of staying ahead of the game where I'm not finding out that I have a problem that I've had for years and years? And so I wanted to talk about some of those screening recommendations today.
There's a lot of things that people walk around without knowledge. They have high blood pressure, for instance, and it's silent, right? I mean, if they may occasionally have a headache or something, and they don't take that into account. But I would imagine even people who are pre-diabetic, for instance, there's any number of things. People can be walking around and be completely unawares that this is going on.
Exactly, yeah. And those are two of the big things that we screen for on a regular basis. I mean, we definitely look at blood pressure every time we have patients come into the office, even kids, because with vital signs, we can tell a lot about what's going on inside somebody's body. It's one of the best ways to screen for things like dehydration or, any issue as far as like anemia. We can see changes in blood pressure. After 18, that's one of the recommendations that's given to us, is that we check regularly people for high blood pressure. We see it in kids all the time, 18, 19-year-old kids who, I guess technically they're adults, but, they come in and they have high blood pressure without symptoms. And by and large, that's the presentation of high blood pressure. You don't feel bad. You don't feel sick. You don't have headaches. Occasionally, we'll get people who have some symptoms associated with high blood pressure, but by and large, it's called the silent killer. It's a very asymptomatic disease. So how do you know if you have high blood pressure? Well, you check your blood pressure.
Mm-hmm.
So, we make sure that we check that on a regular basis when patients come into the office. We talk a lot about doing preventative wellness labs. So most insurances, and, I try not to talk too much about the Affordable Health Care Act for a couple of reasons. But one of the good things with it.
You're a healer, not a politician.
Exactly. I try not to get into that. One of the good things about it is, there's a lot of provisions as far as screening tests that are out there. And we're able to screen patients on a regular basis for diseases. Maybe more than we necessarily need to in terms of checking blood work and things like that. But most insurances will say, check it once a year. So yeah, we check it once a year because we catch things all the time that are off, and we're able to take care of things earlier than we would if, someone developed symptoms associated with that disease, like diabetes, like you had mentioned earlier.
Mm-hmm. Well, when we talk about this, I can remember going to my doctor 20 years ago, and I'd go in for updates and checkups, and there was no blood work. And then within a few years, before every appointment, I would go to the lab, get my blood drawn, and a couple of days in advance of my appointment. So then they would actually have that analyzed. So when I would walk in for that checkup, they'd have the list in front of them, and they could talk to me about all of these various things. That was the big change that I saw in just a very short period in medicine in the last 2 decades.
Yeah, and we kind of this mentality prior to that time that if you looked good, if you felt good, then everything was okay. And that's not always the case. We have a lot of patients that look like they're healthy, they act like they're healthy, and they feel healthy, but they're not necessarily healthy. There's things going on inside the body that they can't see. We have a lot of patients that have, really high cholesterol, and you know, we really minimize the effects of high cholesterol, but over time, that builds up in the arteries, and before long, by the time people get into their 50s and 60s, if they've had high cholesterol for decades, then we're looking at these blood vessels inside the heart that are very, very clogged.
We've got to take a short break. I've got more coming up with Jeremy Daly in just a few minutes. He's a physician assistant from Tripp Family Medicine here in Twin Falls. We've got 16 and about 20 minutes away from 9 o'clock. It is going to be warming up gradually through the day and actually through the week. So our brief flirtation with winter is only going to last a couple of more days. Jeremy Daly is a physician assistant at Tripp Family Medicine in Twin Falls. Hey, we should review, Jeremy, in a minute, the contact information. I just wanted to point out, though, if you've got a question or comment, 208 736 0300. It's coming up on 8:43, and we're at 16. Bill Colley with you as well this morning. Uh, but for people out there who they hear a lot about the office and they know that you're taking new patients, but on the other hand, sometimes people, how do I get a hold of them? So I guess there's a number of ways they can get in touch with Tripp Family Medicine.
Yeah. So I always recommend patients or potential patients if they're wanting to get to know us. We have a good website. It's trippfamilymedicine.com, and
With
that's
two P's
with
in the
two
Tripp.
P's. And so I think that's a great way to get to know us. We all have our bios on there, and you can learn a little bit about each of us and our experience and education and things like that. Um, we have Facebook page, and that's being updated quite a bit. Events that happen with us and in the community that we're involved in. Like last night, if you get a chance to see our Facebook page, so Dr. Tripp was involved in something called micro needling. So if you don't know what that is, sometimes they call those the vampire facials, and basically it's like aerating the lawn but on your face, and it's this controlled injury to the face. And so there's a video of him having this micro needling done on Facebook, and pretty entertaining to say the least. Anytime Dr. Tripp's involved in something, it's fairly entertaining.
So for a few days, he won't look like Dick Vermeil.
That's right.
Yeah.
But things like that. We like to make sure that we keep people involved in what we're doing. And you can call us at 933-4400. We have a really friendly staff. They do a great job of fielding calls and helping new patients out with any questions that they have, and finding the right person for them as far as a provider to take care of them that maybe will fit their needs.
We were having a conversation off air. We talk, of course, I'm at an age where I talk a lot about medical issues anyway. It's funny, when you're a kid and you see your dad and his friends sitting around all talking about that, you go, wow, yeah, old guys. Well, I'm in that group now where we all sit around and talk about that. But it got there faster than I expected. But we were talking off air. Sometimes the numbers that people see when they have their blood work done and other various tests done uh, could point to a problem. But I was telling you in a couple of instances where I had issues come up where people said, "Oh, you're going to be really tired because of this," and "Are you falling asleep at the desk or behind the wheel?" And my answers were always no, no, no. And so sometimes the numbers themselves don't tell the full story.
Totally. Yeah. We were talking about cholesterol. We were talking about things like testosterone. And the truth is that sometimes the numbers say there may be an issue. Sometimes the numbers say there is an issue. And as a clinician, we try to be very sensitive to those things, and we try to correlate that with what we call clinical findings, things that we see in the office, things that people complain of, things that correlate with a certain disease process. And sometimes it doesn't. Sometimes it doesn't go together. And one of the biggest things that I think we try to focus on in our patient care is we focus on patients and what they're experiencing, and not the numbers. There's a lot of times when numbers will say you may need this, or it looks like this is an issue. and sometimes that doesn't correlate with what the patient is experiencing, and so we don't treat it, or we treat it maybe temporarily to see if it makes quality of life better, and if it doesn't, sometimes we don't.
I know that in the case of I had apnea, and I had a lot of apneas in 1 hour that I was tested, and obviously that's a health risk. However, this is eliminated almost. I think the CPAP mask took me down to like 2 in an hour,
Hmm.
so it made a huge difference. But the reason I primarily used the CPAP mask is because I don't want to wake the neighborhood snoring. So it was for me. It's the benefit is actually keeping me quiet at night. Uh, at the apnea too, but the secondary thing that I use it for is because I wasn't tired even with all the apnea. I did not feel tired, but it allowed me to basically quiet the neighborhood down. I live in an apartment building, and I know the people who might live upstairs don't want to hear that all night long.
Well, and I often joke with patients about sleep apnea, and I say, the reason I'm treating you is for your wife or your
Yeah, yeah,
significant other, right? To make sure that they're getting a good night's sleep, because that's usually the motivation for people to come in to have a sleep apnea screening is, hey, this guy or gal, most of the time it's guys, he's snoring all night long, he's stopping breathing during the night. It's these witnessed apneic events are what they called. Uh, and basically, we 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 treat it because somebody else is complaining about it, and so your case is, not unlike many. But as far as a lot of these screening tests go, we talk a lot about things like doing a colonoscopy at age 50. I mean, most people aren't feeling like, well, I need to have a colonoscopy. Most people aren't looking forward to a
right,
colonoscopy.
right.
But we catch a lot of precancerous lesions, and I've had a couple of patients who we caught some major colon cancers in those individuals, and we had caught them early enough that they didn't have to do things like chemotherapy, they didn't have to do things like radiation therapy. And so for those people, I mean, those screening tests put them in a position to maybe have saved their life for one, but also kept them from having to wait until all of a sudden they couldn't use the restroom anymore, or they had all sorts of other issues going on with their bowels, and that led them to the doctor's office only to find out that it had spread to other places in the body. So, those are some of the benefits that we see from some of the screening tests, like cancer screening. So we talk about colonoscopies a lot. In women, we talk about well woman exams, and women tend to be better at coming into the office for things like this. And I wanted to point out that the new recommendation, because there's a lot of women that they really don't want to come in to have their well woman exam done, which I get. But the new recommendation from the USPSTF, as far as when do we screen for cervical cancer, well, in women ages 21 to 65, definitely every 3 years, we do what's called cytology, and that's sometimes known as a pap smear. So that needs to be done every 3 years. Um, but in women over 30, if they have low risk, then sometimes we're going 5 years in between these tests, and we check for things like HPV, which is the cause of cervical cancer in women. And we're able to spread out the amount of time that we're screening. So there's some cases where that used to be done every year, and now the recommendation is, in women over 30, a lot of times we're just seeing them every 5 years for that particular exam. So there's some recommendations that have changed. So I wanted to make sure that we got some of those out there on the air. Um, but there are a lot more, and we're finding that if we screen just a little bit of screening, and a lot of times insurance will cover these screening tests, and so it's not a lot of money out of pocket to look at these things.
And I've got to add to this. I was just reading where in England, of course, they have a national health insurance
Yeah.
uh, program, but in Scotland, of course, they break it up by obviously the different countries that are in the United Kingdom.
Hmm.
They've changed the number of visits people will need for a lot of their tests, and a lot of these might even be for cancer screening. But they've looked at research and said we were doing them every 6 months. Some of these tests we may be able to do every 18 months or every 3 years. Now, is it the pressure to control costs, or is it truly? I think that they must have had to look at this and say, we're doing all of these tests, but they may not all be necessary this frequently. And I think that there's even more of that going on in this country now, too.
Yeah, exactly. I mean, there's some things, with colonoscopies, for instance. Sometimes people will get one at 50, and then they're not getting one until they're 60. But if they've got polyps or they've got precancerous lesions, sometimes it's as soon as a year or 2 years that they're going back for another colonoscopy. So it really just depends on the individual. And there are some tests, and I feel like most of the time, I mean, there's a lot of conspiracy theories out there, but most of the time, the recommendations that are given are really from an altruistic standpoint. I mean, the research that is done is either trying to figure out, are we doing these things too often? Are we spending too much of people's money? Or even, from an insurance standpoint, are we spending insurance's money too much? Which is a big deal, right? Because I mean, if we were doing colonoscopies every year, I mean, the amount that the insurance would be paying out, especially if it was the recommendation and they were forced to pay that, would be a ton. It'd be astronomical. And so premiums would go up. So, you know, some of these screening tests, they help to, I think, bring down the cost of medicine, especially if we can do preventative medicine. But there is some of that, where it does, I think, bring up the cost of premiums if we're doing it too often. And so there's benefits on both sides to being efficient in screening for disease.
I was going to say, I remember my brother was a rarity in the family. He passed away from colon cancer,
Hmm.
and he had two different stretches where first it was supposedly surgery. He had to go through that. Second time around, it came back a few years later, and it was just such a tough cancer. It killed him. Very sad story. But he was the first person in our family history to ever have that. So I underwent the colonoscopy when of course, the doctor will ask you, or the PA will ask you, is there any family history in your family of these diseases? And so if you say yes, you're likely going to get a screening. But then after my colonoscopy, I can remember the doctor looking over everything and saying, "This is very good." And he said, "In fact, I can sometimes look at these and think that some people will never have this issue because he could just tell by texture, I suppose." But and my brother lived in a couple of places where there may have been some radioactive hazards and the like. He lived near Chernobyl for a while in one
Mm.
of his jobs. But the fact of the matter is, family history does play some, at least it should play some role in this.
Yeah, it's huge. I mean, we talk about breast cancer screening in women and men, and if there's a strong family history of certain types, we call them the BRCA1 and 2 genes, the breast cancer genes, and those women they have a much higher risk, and so we're screening earlier on. I mean, the recommendation in general from the USPSTF is to check for breast cancer after age 40 every 1 to 2 years, depending on what kind of mammogram we see. But in some women, we're screening in their 30s and their 20s, depending on their family histories. And so it does make a big difference. Yeah, I mean,
And then if they do go through and they have the treatment, they're going to have face more intense screening afterwards because, as I'm told, there's mutations that happen and sometimes the cancer comes back.
sure. Yeah, I mean, once you've been diagnosed with cancer, I mean, you're usually very closely followed for years to come. I mean, there's many times when we do our best to treat and screen and things like that. And I've had a couple of cases over the last few months where, you know, despite the best efforts of the clinicians overlooking some cases and taking care of people that have a history of cancers, there's been recurrence of cancer. And, if we could, do uh, real intensive screening on everyone, do things like PET scans and, you know, and find if there's any kind of chance of cancer in everyone, then it would be great if there wasn't a risk for radiation and things like that. But it's not cost effective and it's not efficient. It's not an efficient way to screen.
I would say, though, that if you're a patient at Dr. Tripp's office, just use the recommendations from the office about how often you go through blood work and screenings and the like, because the four of you have a pretty good grasp on how this works.
Yeah, we try to make sure that we look at all the factors that we need to when we're taking care of our patients, whether it's family history, personal history, exposures, things like that all come into play when we're making best recommendations for our patients. And we try to stay abreast of all these things and make sure that we're giving the best recommendations for our patients based on the research that's out there and the experience that we have as clinicians. So it for people that haven't been doing regular screenings, it's pretty easy. And if you have health insurance, it and most of the time is very affordable. Sometimes there's no cost or very little cost above and beyond what you're paying as far as your health insurance premium. So it's a great way to make sure that you're not having these diseases. And for those that don't have health insurance, you know, as far as investing a little bit of your money in screening, I think a lot of times it's worth it, especially for things like hypertension, high blood pressure, and diabetes. It's better to catch it now rather than have a major hospitalization or a major event that's going to have some sort of astronomical cost, and not only cost in terms of financial, but physical cost, quality of life cost that comes along with it. So get screened.
Yeah, I was going to say your insurer would be. It's like the old Fram oil commercial: "Pay me now or pay me later." Your insurer looks at that and says, "Better to catch it early than pay the extreme costs later for that care that would come along."
Exactly.
We want to thank Jeremy Daly for joining us this morning. We're coming up on 9 o'clock. Jeremy from Tripp Family Medicine here in Twin Falls, located on Fillmore Street, directly across from the main post office. And remember, life's too short not to feel good. Coming up after 9 o'clock news, Nathan Jerky joins us. He's the project manager, as I understand it, for the proposed changes coming to the interchange at the highway coming off the interstate at Route 93 in Jerome. That's on the way in just a few minutes following Fox News.